works on a different mandate. We are particularly working now on metabolic disorders. Based in Bangalore. My office is in Ashoka Pillars, Jayanagar. My aim today will be to just give an overview of what addiction addiction, mental health. Let's say my topic was Ayurveda and addiction, mental health. Overview of the principles which are dealt. Probably, I think most of the audience here and across might not have known about what actually Ayurveda deals with in terms of addiction medicine. Because mental health management through Ayurvedic medicine is, though Ayurveda is popularly known for management of different disorders with commonly known herbs and so on. But then mental health is something which not many are exposed to in terms of what were dealt with as part of subject by preceptors of Ayurveda like Charaka, Sushruta and so on. Whether it was covered or whether it has been dealt in detail on and all these things. So this is my aim will be to convey things about mental health with special reference to addiction. And probably so with that perspective I prepared my presentation. I didn't go in detail about everything because each one would involve a lot of time. Let me start off by introducing the concept of addiction as it has been dealt in the texts of Ayurveda. Now, Charaka Samhita is written by Charaka, which probably most of us know that he was one of the stalwarts of Ayurvedic medicine, and all the practice which is prevalent today is based on the principles of Charaka and whatever he has written. He was basically a man of medicine, like Sushruta was man of surgery. And Charaka, in Charaka, there is one separate section on mental health, on addiction. And the name of the chapter is known as Madatyaya. Mada-atyaya. Some of the terminologies which I would use today in my presentation will be from Sanskrit because we are helpless because most of the concepts are said in Sanskrit, and the translation of that I will be going along, because original Sanskrit terminologies and English translations sometimes will not match. So therefore I also introduce wherever it was necessary and important. This is very important hymn, or we call it shloka, which is present in Charaka. It says Nivritaha sarva madhye bhyoho naro yascha jitendriyaha sharira manasair dhiman vikaraihi nasa yujyate. He says, one who abstains from all intoxicating substances, and one who has self-control, that is jitendriya, does not get afflicted by diseases of mind and body. This is a very affirmative statement which Charaka makes in his text. Now, the background is that the group of dietary material substances known as, which involve fermentation and which involve alcohol has been mentioned in therapeutics as well as in diet in Ayurveda. It's not that alcohol has not been mentioned. Alcohol has been mentioned for dietary intake, also for different medicinal preparations in Ayurveda, and therefore probably Charaka has devoted one full chapter on it because of the very specific nature of an alcoholic preparation, that is to cause an addiction. So he says, when he begins the chapter, he says that probably all of you know or have been taking alcohol since long, but then this is a very important or a very nasty kind of substance that can cause or lead you to death and diseases, and therefore beware. I'm going to talk about what harm it can do to you when it is inappropriately consumed. And this is how he starts. Before I go into the concepts, just give a brief introduction of Ayurvedic physiology and pathology. It is very simple. The whole body, the functionality of the whole body has been divided into two, Sharira and Manas, body and mind. And Sharira is governed by three specific biodynamic forces, which are known as doshas, Vata, Pitta and Kapha. Most of us may be aware of these things. And Manas is governed by Rajas and Tamas. Sharira by Vata, Pitta and Kapha, and Manas by Rajas and Tamas. These are doshas. Now, one aspect is Manas can function, or if the Manas is functioning in harmony, then it is known as Sattva. Sattva is a term which describes harmony or equilibrium of mind. Now, there is a very strong interaction between these two. Vata, Pitta and Rajas, they interact with each other. Vata, Kapha and Tamas interact with each other. Let's say when we understand Vata, the mainly Vata Gati is the movement. So the neuroendocrine and all the physiological processes, mechanisms of reactions that occurs can be compared to Vata, and Pitta is metabolism. Kapha is anabolism. And when we talk of Rajas, Rajas is indicative of all excitatory and hyper kind of activities denoted by the term Rajas, and Tamas is most of inhibitory, ignorant activity where there is nothing. These kind of things are denoted by Tamas. So they interact with, and this also conveys to us how a disease of the mind affects the diseases of the body, and disease of the body affects the disease of the mind. So whenever descriptions of diseases are given, both these aspects are covered by Charaka and Shushruta, or these people who have written the books. And then the next concept is the concept of Prakriti. Now, this is a method of classifying normal human beings, which is a unique feature of Ayurvedic system. This defines that how a person is, or how he will behave. Now, this is a concept that can reduce physiological properties, strengths, vulnerabilities, and behavior of a human being. There is one can predict how this person might be in terms of behavior or in terms of vulnerabilities. Now, there are determinants of Prakriti, but Ayurveda says that these are the factors which are very important in determining what Prakriti a person might belong to. And Prakriti is also named after the doshas, that is Vata, Pitta, Kapha, Rajas, Tamas. So you have a Vata Prakriti person, Pitta Prakriti person, Kapha Prakriti person, combination of these. And also in terms of mind, you have Rajasika, Tamasika and so on. Now the determinants are depending on the Shukra Shonita, that is the reproductive materials, and then uterine environment of the mother, and then what the mother is, how she leads, what is her lifestyle during pregnancy, and then also the Pancha Mahabhutas. Pancha Mahabhutas are elemental composition like fire, air, water. These are elements which have been described in Ayurveda. They constitute a very important part in determining the person's constitution. And then environmental influences also has been said, like Jati Prasakta, that is a race, Kula Prasakta, community, Desha, the place where he lives, Vaya, the age of the person, and Pratyatmani, there are some very specific characteristics which a person might have. Now, why I'm saying this is addiction has been seen as a domain of mental disease. It's not so. I'm not going into different statistics, but then, which probably all of you are aware of, but then there are normal people also who have the tendency or vulnerability for addiction, and subclinically, they don't probably go into a state where they have to consult, but then they all have the problem of social drinking. That's what they describe. But then a person under normalcy also can be influenced by these doshas. So then that's how the texts, when they describe, they say that a person who's born and who's constituted of a particular constitution might have some kind of vulnerability, and he should undertake such measures so that he does not become vulnerable. Let's say if a person is Rajasika in nature, constitution, his vulnerability towards becoming angry is much more. So then there are suggestions for him. These are the measures which you should take because you are prone to get irritable and all that, something like that. So even in the body also, some constitutions might be vulnerable to acquire some disease very fast when compared to another constitutional person. So even the measures have been told that if you belong to this prakriti, you're supposed to follow these regimen so that you avoid getting into such things. So we can compare this to personality traits or personality related things which in modern psychiatry we know of. Now coming into addiction as such, most of the descriptions are based on alcohol, because as I was saying now, although we have mentioning of opioid like opium and other drugs, they have been classified under the pharmaceutical substances. We have a branch known as Dravya Guna, wherein different such intoxicating substances have been mentioned in preparations of medicines. They have not been talked about much throughout in terms of addiction, probably because the prevalence or incidence was less. We don't know, let's say, because I am talking of 5,000 years and more. So alcohol related issues have been told, but then they have been very specific in saying that any substance that causes intoxication is has been mentioned. So that is known as madakari dravya has been defined as buddhim lumpati yat dravyam madakari taduchyate. That which leads to perturbed cognition is known as madakari, and the term used is mada. And addiction has been named as vyasana or madalalasa or madandha. Mada is addiction, and then lalasa is greed. Madandha is one who becomes blind in intoxication. These are literal translations. And then these substances, madakari or substances that cause addiction, have been known for two very important properties. They are vyavayi and vikasi. These are Sanskrit terminologies. Vikasi is that which rapidly afflicts, and then vyavayi is pervasive. As soon as you take it, it spreads throughout the body, and every system probably in the body gets affected. So that is a very specific quality of a madakari substance. And then when I was talking of rajas, tamas, vata, pitta, kapha and prakriti, this is what comes out. Rajas and tamas, when the influence of these two manasika doshas are there, the person becomes vulnerable. And emotions are something which he might not be able to control. Like for example, kama, krodha, lobha, moha, irshya, amana, mada, shoka, chittodvega, bhaya, etc. And then when a person is under the influence of all these, then the chances of him falling a victim of addiction are more. If he is having some kind of a psychiatric disease, or if he is unable to control some of the emotional factors, and the rajas and tamas form the root or the source of making this person or making a person vulnerable. So when a person is able to control himself, then that is what is said as sattva, who is a strong will. Then the description of madhya dosha, what happens when madhya or when an intoxicating substance, especially alcohol, is consumed inappropriately. So there are different classifications which have been done. One is when Charaka speaks of madatyaya, he speaks that a person who presents to you with intoxication, he will be suffering from. So as we all know that we have solutions, very easy solutions for seekers. We don't have solutions for people who don't seek. Now, the person who comes to you will present with acute or some current problems which he might be suffering from. And then later you will have to address how he will not fall victim to addiction again, in the sense of self-control. So he says that he will be having emotional upheaval like moha, bhaya, krodha, all these. And then also mental disorders very specifically has been mentioned. Unmada is a terminology used for psychosis, schizophrenia and like disorders. Apasmara are seizure-like disorders with cognitive impairment. And then we have shoka, depression. And then smriti vibhramsha, memory loss. Upahita vijnana, inability to think rationally. Prajagara, insomnia. Brahupralapa, speech disturbance. And then neurological manifestations like altered states of consciousness, which is known as Mada. Murcha is pre-syncope or syncopal, conditions. Sharira Kampa, motor symptoms. And then Shirak Kampa, also loss of motor control. And then there are gastrointestinal manifestations like, hikka, atisara, chhardi, rochaka, trishna, daha, hiccup, diarrhea, vomiting, tastelessness, thirst, burning sensation. Then respiratory like shwasa, breathlessness, ENT diseases. Autonomic manifestations like excessive, sweating and horripilation, musculoskeletal pains, vague pains in the body, and then systemic manifestations like jwara, tandra, sthaimithya, loss of agility, gaurava, heaviness, and then also in the end he says he can also suffer from mrityu, that is death. It might be a presenting complaint or it might be a symptom of madhya dosha. And then when we come to the management, Ayurveda has described management in two very broad domains. One is how do you manage a person suffering from a disease and how do you prevent it? Now, when we talk of treatment, yukti vyapashraya chikitsa, that is the terminology, which says that pharmacological and non-pharmacological interventions which you do directly. This is known as yukti vyapashraya. Means yukti is logic. So yukti means how do you use, what is the dose you prescribe, what is the regimen you prescribe and all that. So daiva vyapashraya chikitsa is spiritual treatments. So this is also a very important feature wherein Ayurveda says that spiritual treatments can be resorted to if the patient is okay with it. And then there are people who are specialized in this area, and please refer it to them. Charaka doesn't say that you do the spiritual treatment, but refer to people who are very adept in spiritual treatments. And then Sattvavajaya is, there is a huge list of self-control and related principles that have been listed, and these have to be administered to the patient. Then in the preventive aspects, jnana, educate him, vijnana, training in developing skills, give him dhairya, development of coping mechanisms, smriti, give him memory enhancing kind of measures, and then samadhi, or teach him yoga, and because Charaka and Patanjali were contemporaries. And then some aspects of yoga has been mentioned by Charaka, saying that, there is one speciality which is known as yoga, which specifically deals with the spiritual attainment, and they have a lot to say how to administer self-control. So you also refer them to yoga practitioners. That's what is the purport of the statement. Now, some diets have been mentioned. Probably these are some things which we regularly advise patients also, and these have been mentioned by Charaka, Sushruta, and so on, wherein what kind of diet a person who's suffering, who is of a Vata Prakriti or Vata constitution should be taking, and which are good in Madatyaya, that is alcoholism. Wheat and shali. Shali is a terminology used for a type of rice which is grown in 60 days. It is known as Shashtika Shali. And then pulses, masha, that is black gram, udad, what we call. And then roasted cereals. These are puffed rice and so on. These are made into powder and used as sattu. North Indians might know. And then fruits, dadima, pomegranate, vrikshamla. This is kokum. I'll have some photos. I can show it to you. And matulunga, wild lemon. These are used. And digestives like ginger, cumin seeds, cinnamomum, that is we call in Kannada chekke. And then ela, that is cardamom. And then the cinnamomum tamala patra, which is used. These are all spices also which are currently used in Indian kitchen. And maricha, pepper. And meat soups, bird meats have been suggested. Fish from marshy land have been suggested. And then there is a lot of stress on intake of milk, curds, and buttermilk when the person who's given to lot of alcohol intake. Similarly, for pitta, goduma and shali, wheat and rice are same, and then sattu, laja, these are same. In terms of pulses, green gram, moong, this is specifically good for people who belong to pitta type of constitution and who are alcoholics. And vegetables, many other have been suggested, but these are, some I have listed only those that which have to be used invariably in such people. Snake guard, patola, padavalkai is something which in Kannada they say. But then in fruits we have amalaka. Amalaka after pomegranate has been mentioned in all three prakritis, and then amalaka is amla, which is to be taken specifically by pitta prakriti, and grapes, and kharjura, that is dates. And digestives, almost all of them are the same. And here goat meat soup, and then rabbit, and then black buck, and these animals have been mentioned as good in patients suffering from alcoholism. Milk, curds, and buttermilk remains the same. And then we have for kapha, in cereals, yava, barley is very good for patients who are suffering from alcoholism, who belong to kapha prakriti. And then in pulses, horse gram, that is kulat is good. And vegetables, radish and snake gourd. And then fruits, there are inclusions of kokum, grapes, dates. Kokum is an inclusion. And digestives, most are similar, except that savarchana lavana, that is black salt, kala namak, is suggested, and cumin, jeeraka, is suggested. And meat is to be taken of animals who inhabit arid lands, because kapha is supposed to be a wet prakriti, and therefore the animals which inhabit arid lands, dry lands, are supposed to be good. And then milk products are the same. These are hapusha. This is one herb which is used as a very good digestive, because appetite is one of the very important casualty in a patient who is alcoholic. And hapusha, and then this is yavani. This also some people use it. And then this is that patra we use when we make palav and so on. And tak is that shali rice, looks like it is red. Red rice it is known as. And then this is kala namak, which I think most of us might know. And this is the citrus, wild lemon citrus medica, which is amla vetasa, the bijapura, these are the names she's given. And kokum. Of late, a lot of studies on kokum, pomegranate, and these kind of fruits have been done. Kokum, there are some reports which say that it has very good immunomodulatory effect, and it has been tried in patients suffering from AIDS and so on. And then citrus, and it is also very good anti-lipidemic, and also anti-obesity kind of studies are going on. And this kokum is used specifically as a dietary ingredient in coastal Karnataka, Kerala, and most of these kind of places. Garcinia indica, Garcinia cambogia, and for alcoholism, this has been emphasized in the texts. Then the principles of addiction. Charaka says, madhyameva alpa pramanena diyate. What happens is, a patient who is an alcoholic will not be able to take your decoctions, your medicines. You mix it with alcohol and give it to him. No, alcohol we understand as being prepared or as being available in the market now. But then Ayurveda has different varieties of alcohol that are prepared, indigenously, using cereals, pulses, and so on. Sidhu, Varuni, there are many different varieties of alcohol, and preparation, how to make it, also has been given. So he says that for a specific person, this specific cereal can be used. Like, let's say, for example, yava, that is barley, is good in patients suffering from kapha, or a person who belongs to kapha prakriti or constitution. So you use the alcohol which is prepared out of barley and mix these medicinal substances in a low quantity, and then start giving it to him, because he will not accept in different other forms. If you tell him that this is also alcohol and you like it, you please take it. That's how you start the treatment. So then when it starts digesting, when it gets into an absorption is more or good, and that is when you go into different other procedures. And the procedures include Vamana, Virechana, Basti, Nasya, and Raktamoksha. These are known as Panchakarma. Most of us might be knowing about these, it appears in papers and so on. Induced vomiting, induced purgation, rectal. Therapeutic enema is not only for clearing bowels, it is a rectal administration of medicines. And then Nasya is nasal instillation of medicines, and Rakta Mokshan is bloodletting. Now, these therapies appropriately, based on the patient's presentation, are being done. There is a great emphasis on milk and ghee being used in patients, who are put into alcohol rehabilitation. Digestives, sour fruits, different types of salts. 8 types of salts have been said, like Kala Namak. There is rock salt, black salt, and many others, Samudra Lavana, and so on. And then use of polyherbal formulations, and one of the very important polyherbal formulation which is used in alcohol rehabilitation is Dashamula, combination of 10 roots of medicinal herbs. And Dashamula Rishta, Dashamula Kashaya, most of us who are given to or who have some background of Ayurveda might know about this. And then Rasayana therapy. Rasayana is a method, it is a domain which has in which the different antioxidants or health promoting substances are used following a different regimen. For example, Amla is known as the best Rasayana. Now, when you give this in a specific regimen, you might have heard of Chyawanprash. Chyawanprash, major ingredient is Amla. And this is used with different other ingredients and prepared. And then whatever Chyawanprash which is available is to be taken in a particular regimen. Let's say about 50 grams without eating breakfast, accompanied with this and that, and different dietary regimen that have to be followed. So this is known as Rasayana therapy. They say that whatever loss of tissues or whatever health loss that has occurred, there is a chance of rejuvenation. And then spiritual therapies have been suggested. So these are principles of therapies in a patient who's been admitted or who is under alcohol rehabilitation. Now, there is a method, Oka Satmya, which is, I think, a unique another feature, wherein how to stop incompatible behavior and how to introduce a compatible behavior. This concept is not that you ask him to stop today abruptly and then start something, or it says that an individual can adapt it to any incompatible food behavior in practice for a long time. If you have heard of Kautilya's Arthashastra, Chandragupta Maurya, and so on, we have stories saying that Chandragupta Maurya was administered very small quantities of poison so that he could be made immune to somebody who might be, planning to kill him. So this was known as Satmyata, means you can use small quantities of an incompatible substance on a person for a very long time and then go on increasing the dose. He becomes adapted to that particular thing and acquires properties. Even Madhya, when Madhya is being spoken of, that is alcohol, it is said that the person starts off with small quantity initially, but then goes on and on. And sometimes we see that a person is alcoholic but is not suffering from any disease. Now, what does it mean? So it explains that some substance which, even though incompatible, can become compatible to him for a long time, but it doesn't nullify the bad effects it might have on the health. Now, when it manifests would be when his resisting system, it fails, then it manifests. So for some people it might manifest very early. For some people, a person can go on taking an incompatible substance for a long time and not suffer from diseases at all. So this explanation has been given, and then he says that this doesn't nullify the problems that are associated by taking these incompatible substances. So this is known as Oka Satmya, and this has been explained for anything. If a person is used to some kind of food material, how will he change, or alcohol or whatever. So it's 1/4. I have given one small table as a representative, saying that the first day 3/4 of whatever he was taking incompatible, let him take, and 1/4 is introduced. And then second day it will be half and half. Third day it will be half and half, and fourth 1/4 and 3/4. Fifth day it will be 1/4 and 3/4 again. The sixth day 1/4, 3/4 again, and seventh day Ahita becomes 0, Hita becomes 1. Ahita is incompatible, Hita is wholesome. So that's how some people mention it, depending on what he is taking: a 7-day schedule, 15-day schedule, 30-day schedule, and so on. This is known as Padam Shika Krama, phased adaptation. So when you are withdrawing alcohol, also this krama has to be followed, so that slowly you withdraw, and or to avoid an abrupt withdrawal, so that withdrawal related issues, or probably, different other issues might be confounding there. This is known as Achara Rasayana. Achara Rasayana has been suggested as code of conduct, which is supposed to be followed by all of us and also administered to the patient. He says that try your best to see that he should satya, akrodha, control of krodha, anayasa, avoidance of stress, nivritam, madhya maithunam, vyasana, madhya maithuna, all these indulgences to be stopped. Desha kala pramana, where I live, what is the kind of environment that I am in, be very compatible to that environment. Yuktignya, be very rational. And then anahankrita, don't be egotistic. See that you lead your life. Then conduct, ahimsa. Then dana, helping others. Priyavadi, pleasant speech. Prashanta, composed. Upasita, deva, guru, vruddha, astika, jitatmanam. Be very respectful towards people who are respected in the society. And then anrishasya param, avoidance of bad behavior. Karunavedi, kind. Then spiritual orientation, japa, shaucha, tapasvi, adhyatma, pramanendyam. Basically, the purport is that spiritual, to whichever religion we are. So be very spiritual in that and see that there is an amount of philosophy in your life. And then dharma shastra, read, books which give you knowledge about these things. So these have been, suggested as achara rasayana, which has to be administered. There are the principles, there are ways of administering these. And then Charaka finally says that na akshobhya hi mano madhyam shariram vihityacha kuryat madatyaya tasmat ishtavyaha harshani kriya. It is impossible without the involvement of mind that a person goes into alcohol. A mind means without the involvement of kshobana of manas getting afflicted by rajas or tamas. So it is certain that his mind is vulnerable, and that is why he has gone into an intoxication. And when he vulnerable in the sense either rajas or tamas. So kuryat madatyayam, so do such kind of psychotherapy which is harshani, which increases his happiness, make him happy so that he doesn't go back. So for that he says that see that all his issues which might be leading to mana kshobana, whatever, rajas or tamas or whatever. So these have to be addressed and his level of happiness have to be increased. Then only his returning back to addiction can be stopped. Otherwise, these things will continue. These things might continue. So, this is a principle which again, when I started, says madhya is very, bad. And then finally he says that in terms of psychotherapy, harshani kriya you do so that the person comes out of this addiction. Now, mentioning of addiction by other substances have not been covered because all the principles, and even in the beginning he says that, madakari dravyas tend to have the same kind of effect, and your efforts will be to stop it. So with this I come to end. I end it with a shloka from Sushruta. Ekam shastram adhiyano navidhyat shastra nischayam tasmat bahushrutah shastram vijaniyat chikitsakaha. It is the duty of a physician to look at all sciences. Do not conclude by reading only Ayurveda, he says. Ayurveda is not everything. Ekam shastram adhiyano navidhyat shastra nischayam. Don't conclude anything. Tasmat bahushrutah shastram. Read all the other sciences in the field, and then only you can become successful. Thank you very much.